All right, good morning. I'm gonna go ahead and gonna do the video quiz explaining the settings in ACVC mode. Settings in ACVC mode includes rate, tidal volume, FiO2, PEEP, and waveform. I'd like to explain the A in AC. A meaning the amount of flow that is given to the patient in order to achieve the set amount of tidal volume. And for C, meaning control, means it's almost like the sensitivity or the set threshold sensitivity trigger needed by the ventilator in order to help the patient, give them a little bit of a push to help the patient achieve the set tidal volume. Okay, and then let's discuss which settings help to ventilate the patient. In order to help the patient ventilate in ACVC mode, we'd want to increase the following: increase of tidal volume, respiratory rate, and flow, and increase the E time. And other settings is that you want to have a square waveform, and you'd want to decrease the sensitivity so that the patient is able to trigger more assisted breaths and with the guaranteed set tidal volume. And you'd want to decrease I time. Okay. And ways to oxygenate the patient with ACVC mode is that you'd want to decrease E time, increase I time, decrease the flow, increase the PEEP, and increase the FiO2. Okay. Here I'd like to discuss another probable causes if the patient's PIPs are increased. The peak inspiratory pressure is increased due to elevated airway resistance, meaning that it's harder for the patient to breathe, requiring a lot more pressure for it to push down the set amount of tidal volume that is set in the ventilator. With increased plat pressures, it means that the lungs are starting to stiffen up, meaning it's decrease in compliance, and it takes a lot more pressure for the ventilator to achieve the certain amount of tidal volume. Reason why the max pressure that the maximum pressure that PIPs for the ventilator is 40 centimeters of water pressure, and for plats is 30 centimeters for water pressure. And I skipped the question. Okay. For another issue regarding the increase of both plat and PIP, the probable issue with that is the decrease of lung compliance, meaning the lungs again has stiffened up. And especially it's common with ARDS patients. And what should be done if pressures continue to become high and we have done multiple interventions to try to fix the problem? And what I've learned is that pressure control helps alleviate this problem and most likely able to fix the problem. What varies in volume control? My answer is that the pressures vary, since you can't control that. Okay. Now we're transitioning to ACPC. All right. Settings in pressure control, it's inspiratory pressure, I time, rate, FiO2, PEEP, and E time. To ventilate using pressure control, you'd want to increase inspiratory pressure, decrease the I time, increase the E time, increase respiratory rate, and decrease sensitivity. And on the other hand, in order to oxygenate the patient, you'd want to have increased I time, decrease E time, increase PEEP, and increase FiO2. For total PIP, the formula you use is PIP minus PEEP equals to total PIP. And the maximum PIPs you can have for an adult, it should be around 40 centimeters of water pressure. And for infants, greater than or equal to 1,500 grams, they should be ranging for about 20 to 30 centimeters of water pressure. And for neonates less than 1,500 grams, you want to have 16 to 28 centimeters of water pressure. What varies in pressure control is the volumes. What are the factors that make this vary? It's the lung compliance and the flow. Thank you for your time.